Guests, ladies and gentlemen, good morning. Thank you for allowing me a few moments to speak on behalf of AusAID. I actually hope to come here today and sit in a corner and just absorb all the information coming out of the sessions. But Professor Marcy insisted that a few words from me about the Australian aid program and the work we're doing in the Northern Division won't go astray. And we all know what a persuasive man Professor Marcy can be. So no prizes for guessing who won that argument. I won't take too much time because today's focus is the recently released report titled Poverty in Fiji, Changes from 2002 to 2003 and 2008 to 2009, and of course its policy implications, of which you all have a copy. It's a fascinating read, and Australia is pleased to have had the opportunity to support the compilation of this report. We commend the initiative of the Fiji Bureau of Statistics, Fiji National University, and of course Professor Marcy in bringing the report to the Northern Division to allow stakeholders like yourself a chance to workshop it so that it can inform future planning and policy formulation. Australia is unwavering in its commitment to the implementation of the Millennium Development Goals, or the MDGs as is commonly known. These MDG commitments underpin the Australian aid program and include halving extreme poverty, getting all children into school, and saving lives through strengthened health systems. These are achievable commitments to improve the well-being of the world's poorest people. In Fiji, Australia is strongly committed to supporting the people of this country through its aid program. AusAID recently released the Fiji Country Strategy, in which it reiterates its commitment to targeting poverty and vulnerability in Fiji's most disadvantaged communities. Australia's total bilateral aid to Fiji is set to increase from 18.5 million Australian dollars in 2011 to 36 million Australian dollars by 2013. This increase in funding will allow Australia to focus more on Fiji's rural poor and continue to support our health and education initiatives. AusAID has identified 3 development outcomes for its bilateral program. These are improving access to quality education, strengthening primary health services, building resilience and economic opportunities in disadvantaged communities. Australia has significant programs of assistance to both ministries of education and health, which aims to improve school learning environments, increase children's access to quality education, strengthen primary health services, and address the national non-communicable disease burden. In terms of the Northern Division is an area for the Australian Aid Program in which we're keen to work with stakeholders like yourselves to address the issue of poverty. We're already working with some great organizations around some tangible initiatives which we believe should be some real rewards for the people of the lower level. We support civil society organizations like FRIEND and Pacific Counseling and Social Services, or PCAS, both of whom have offices here in Labasa. This support enables these 2 organizations to engage in saving program schemes and provide counseling services to those who need it. The Fiji Community Development Program is a new program which aims to deliver social and economic benefits to the people of Fiji and of course Labasa through supporting work delivered by strengthened civil society organizations. The objectives of this program is to mitigate social and economic hardship faced by poor, vulnerable, and excluded communities by funding community development work of CSOs and to strengthen the capacity of these organizations. The program is a 5-year program. It's currently valued at 15 million Australian dollars, and it's anticipated that this program will set up offices in Suva, Lotoka, and of course right here in Labasa. We also have a significant program of assistance to the Ministry of Education that's called the Access to Quality Education Program, which was launched in 2011. And like the name suggests, ACAP aims to improve the physical infrastructure of schools, teaching and learning materials and standards, as well as improve children's access to a quality education. This program, currently valued at 50 million Australian dollars over 5 years, aims to assist 25% of the poorest schools in the country. So roughly this translates to about 180 schools, primary schools, receiving assistance which then should benefit some 43,000 programs for children. The program will ensure that schools in the Northern Division who need this assistance will have an opportunity to access it. Like ACAP, Australia also launched the Fiji Health Sector Support Program in partnership with the Fiji Ministry of Health in 2011. This 5-year program, valued at 23 million Australian dollars, aims to strengthen health service delivery around maternal and child health and NCDs. Other focus areas include primary health care and, of course, systems strengthening. Already there have been a number of initiatives carried out by this program in the Northern Division, namely the revitalization of community health worker network, provision of technical support officers for diabetes and child health, to help divisional staff in monitoring and audits of diabetes and child health equipment, support for exchange attachments for midwives from subdivision rural hospitals up to divisional hospitals, provision of food modules for dietitians outreach program, and provision of drill sets for training in emergency obstetrics. The market development facility is a $3 million project of 2 years, which focuses on employment generation and opportunities to grow markets. It's a relatively new program, and the program team are currently engaged in consultations with key stakeholders in the Northern Division to determine the effective program that will benefit the people of this region. And as a first step, the Australian Aid Program will be providing $700,000 to build the first resource centre for Indigenous women in South-South. The groundbreaking is currently scheduled for September the 5th. I'm conscious of time, so I think I'll leave it there. But I'm happy to have a chat with anyone later on if you have questions about the Australian Aid Program. To round off, this report is pivotal, the report we had to workshop today, because for the first time in the Pacific, the Fiji Bureau of Statistics has mounted 2 household income and expenditure over a space of 5 years, making it possible to obtain solid national data on changes in income levels, income sources, and expenditure patterns over this particular time period. Such data is absolutely vital if stakeholders are to succeed at effectively targeting vulnerable populations, which is largely what the Australian Aid Program is all about. So this important piece of work will inform our own program for years to come. In closing, I'd like to congratulate the hard-working staff of the Fiji Bureau of Statistics under the very capable leadership of the acting government statistician, Mr. Longavatu, for their unwavering commitment to collecting solid data that makes reports like this possible. I'd also like to acknowledge and thank Professor Nasi for his insightful analysis of the data, which will no doubt guide many program design and policy formulation in the near future. I also acknowledge the Fiji National University and thank Dr. Mahima Reddy and his team for agreeing to host these important workshops over the course of this week, and we look forward to ongoing future collaborations like this.